behalf of my colleague, we first want to thank you very much for receiving us to the Sunyani Teaching Hospital. We are grateful to the CEO and the management and in fact the entire staff, because we have observed that they are dedicated, hardworking, and ready to offer quality health services to the people of the Bono region. And we are also happy that this hospital is a teaching hospital. From interacting with the management and the staff, we realize that they are doing well in terms of staff motivation, which is very important to keep them motivated to work and offer quality health services. They've also told us, aside the achievements and the good things that they are doing, there are some challenges. And as a committee, as a health committee, it's part of our duty to ensure that we take these concerns and look for solutions. One has to do with space. We visited some of the units, like the emergency, accident and emergency, the pediatric units, and they need some space because they have some equipment, but they don't have space to operate those equipment, which is the opposite of some health facilities. Some have space, but they don't have equipment. They have equipment, but they don't have the adequate space to operate some of these equipment. Another very important concern has to do with a mammogram. That is very important for breast care. Breast cancer is one of the leading causes of deaths in this country. And we got to Bono East. It was a complaint that they don't have mammogram. Got into this hospital. They don't also have a mammogram, meaning that within this space is of concern because they should have a mammogram, so that as a teaching hospital they offer some screening or some diagnostics for people with breast cancer or breast issues. Other concern of importance has to do with the management of medical waste. It's a concern for residents, concern for the people of this community. So as members representing the people, we visited the site with the management, and we realized that it's an issue that needs critical attention, something that must be addressed, because we all know medical waste is toxic and it has the potential of spreading other diseases. So we've also taken it up as an issue of priority that will add to our report. Then when we go back as a health committee, we will look for some solutions to these challenges. But in all, as a team, we're impressed and we are thankful to management. We encourage them to continue to work, as they are working. They are working very hard, and we think we are happy for that. We wouldn't say it's 100%. We say they are doing well, but they also have some challenges, which I have mentioned. And we can just summarize them into human resource concerns. They need more staff, specialists, and a various mix of staff. We talked about the space or infrastructure. We need to add some infrastructure. And we've talked about the need for medical equipment, because in all these, as a teaching hospital, they need these important issues to be addressed so that they can get to the desired level that they need as a teaching hospital. So yes, they are doing well, but they also have some challenges that we need to support them, and the government will definitely come to their aid, especially The fact that as a teaching hospital, the need to establish a medical school is important. And once you have a teaching hospital that is doing very well, then you know that your medical school would have a teaching center, and the medical students will have side they can do practicals. So we're taking note of their concerns and we'll work to address them. Even entering, you can see the level, Sunyani Teaching Hospital. Maybe the people probably have some concerns, either when they come, certain things, or there are some gaps that need to be addressed. But once it's been given the status adored as such by government, I don't see why people will say it's not a teaching hospital. If there are gaps, we just need, as representatives of the people, drawing government attention, and the desired gaps or the gaps that are there will be addressed. But I don't think the CEO's presentation or whatever, that issue of not being a teaching hospital is there. The issues or problems you are witnessing are issues that will be addressed by this government. Yeah. We all know that His Excellency John Dramani Mahama places high premium on quality health care delivery. We don't have equipment, or there are gaps in the equipment, because for more than 8 years there has not been any serious, bold intervention of doing medical equipment replacement or procurement. Remember, he was the one that brought a lot of equipment in terms of hospital equipment replacement somewhere in 2014, and after that it hasn't happened. In his statement, he has boldly stated that he will take steps again to ensure that we have comprehensive, medical equipment replacement in all the major hospitals in this country, because he believes in quality health delivery. So the people should have hope in His Excellency John Dramani Mahama that a lot of good things that will promote quality health delivery, would be brought by His Excellency John Dramani Mahama. Just to add that, so that that there's hope for the people of this region, the people of the country.